A couple from Alabama traveled to Houston to get life-saving treatment for their twins during pregnancy at Texas Children's Hospital.
The fetuses were fused together with the same blood supply.
Baby.
Jamie and Brian Fisher of Birmingham, Alabama are cherishing every moment with their twin boys, Aaron and Liam. After 2 years of fertility treatments, they decided to place one embryo. It split, and that's when they realized they were having identical twin boys. But devastating news during their 4-month ultrasound.
Definitely quite a shock at that first visit, and that's where we first found out about Texas Children's and the options for treatment there.
And they're ready to hear all the good news and look at a video of their babies, and they find out that there's a real problem that could, if not treated, end up in a 90% chance of losing the pregnancy.
The babies had a condition called twin-to-twin transfusion syndrome. Their doctors suggested they head to Houston for specialized care at Texas Children's Pavilion for Women. Dr. Michael Belfort led their medical team here.
So the twin-twin transfusion syndrome is a syndrome where one baby is essentially transfusing blood or pressure to the other baby. The one baby, the so-called donor baby, stops producing urine, and all the fluid around that baby is slowly resorbed. The other baby is getting additional blood, additional pressure, and the heart of that baby starts to fail. And that baby is trying to get rid of all that fluid by urinating a huge amount. So you get one sac with a large amount of fluid in it, and the other sac where the baby's essentially vacuum packed up against the wall of the uterus.
It's definitely a really hard time in our journey through this pregnancy, just because we didn't know if we'd lose the baby.
They had to wait 3 weeks for the babies to grow stronger. At 19 weeks, Jamie was prepped for surgery.
So what we do is we put a scope into the sac that has a lot of fluid, and we visualize the connections on the placenta that are creating the connections between these two babies. And then we use a laser to basically ablate those connections.
The goal, create 2 sides of the placenta.
Well, the surgery was very successful, and thank God both babies have done very well.
This loving couple relied on their deep faith to get them through the trying times.
I think the biggest thing is it's really when you get to that point, it's the only option. So you kind of have to go in eyes wide open. Like there's no denying what has to be done, and it just allows you to kind of take it head on. And I think Jamie's right. The extra 3 weeks, while tough, did allow us to kind of just come to the conclusion that this is it, and we've got to put our faith in the experts. And I think it was faith well placed.
They were able to go back to Alabama, and the babies were born prematurely, as many twins are, at 32 weeks.
You wouldn't know they're special in that way, that they went through all that before they were even born if you just looked at them. So it's actually really incredible. They're doing fantastic.
And even given their prematurity, they really have been thriving. It was just everything kind of laid perfectly in place to support them through this journey. We kind of had the best team around us, so we're thankful for that.
And Dr. Belfort says the long-term outlook for the twins is ideal. After the successful procedure, there are no side effects from their twin-to-twin transfusion.
They're so cute.
Oh, aren't they precious? Please join me today at 12:30 for my live stream Lunch for the Soul. You can go to fox26houston.com or our Fox 26 Twitter, Facebook, or YouTube pages. We're going to have an in-depth conversation with this amazing couple.
Nice. And they're going to share, I understand, some advice for anybody who's going through a hard time.
Yeah, and just let you know how you can keep a positive attitude, how you can kind of beef up that faith when you're going through a hard time. They certainly have been through it all, and they've just really thrived through it.
Oh.